So clients with high blood pressure, some things that you need to be aware of if they haven't exercised before, this should all be done on the pre-screening, so this is how you'll pick up if they've got high blood pressure or not. If it's extremely high, you've got pre-hypertension or hypertension, you need to send them to a doctor, let them get a referral, see if they're okay, see if any exercises they can or cannot do. When that referral comes back and everything's all clear, some things that you can start on if their fitness level isn't all there, start on 3 days a week, 30 minutes just on aerobic exercises. So aerobic exercises will just get everything stronger, get you feeling better, increase your aerobic endurance, which will be good for the heart. Once that starts, you want to start to work up to about 5 days a week, 45 to 60 minutes a session. They used to say some strength training doesn't work, but recent studies show that it does, and what you want to hit is around 12 to 15 reps. Don't do any isometric training, remember to breathe. Some things to be cautious of is never do your max, because that puts a lot of pressure on people with high blood pressure and it can send it through the roof. So you never want to do your max tests with them or anything like that. So what it actually measures is you got systolic over diastolic. Your systolic is your blood exerting against the artillery wall when the heart beats. Your diastolic indicates the blood pressure exerting against the artillery walls when the heart is resting between beats. And the way that it's measured is millimeters of mercury. So as it gets pushed through, they'll see how much pressure it's under, and then as it's resting, so that's where you get your measurements. So if it's too high, you need to go see a doctor because you're starting to get hypertension, which is just high blood pressure. Some things that you can be careful of is if they start to get dizzy, faint, or if the exercise is too hard. Sometimes if their heart rate increases, you might be able to determine it on that. But if they're taking things like beta blockers or anything like that, it can also cancel out the heart rate. So other ways to test it is your RPE. So you just got to ask them on a scale of 6 to 20, so 6 being resting heart rate 60, 20 being max heart rate 200, depending on the age. And if it's getting up near 16, 17, you know that you're at where you want to keep it, and you don't want to go above that, otherwise it's going to be too much pressure for them.